For 50 years, she was not able to have penetrative sex comfortably with her husband.
I saw a man who, when he went to get his vasectomy, to which his wife drove him, when she picked him up, she said, "You know, dear, I think we made a mistake." So he came to see me for a reversal for baby number 8.
This critical decade of being 35 to 45, where people need to get their shit together, right? Because it will never be as easy as it is today to get in better shape.
Categorically, people are low on consuming protein. And protein is critical to muscle tissue.
I'm realizing I am very protein malnourished.
If you are consistently sore and run down, not recovering from the workouts, or getting weaker instead of getting stronger, then you're overtraining. He looked at me and he said that, "You're not gonna be able to have kids." And I said, "Do I have any sperm?" He goes, "Yes, you do." And I go, "Watch me, I only need one."
But a lot of people think that they can take testosterone and sit and watch TV and eat,
Right,
potato chips.
anything they want.
But is it ever too late
No.
for someone to change their body composition?
No, absolutely not.
Hey folks, welcome to Fertility and Other F Words, the podcast that tackles fertility, sexual health, and every topic in between. No topic too taboo and no question off limits. I'm Dr. Amy Pearlman, a board-certified urologist with expertise in sexual, hormonal, and genitourinary health and co-founder of Prime Institute in Miami, Florida.
And I'm Dr. Larry Lipshultz. I'm professor of urology at Baylor College of Medicine and a specialist in male fertility and other men's health issues.
So Larry, how was your week this week? See anything interesting?
Did I see anything interesting?
Yeah.
Well, we have office hours Monday, Wednesday, and Friday, and operate Tuesday, Thursday. So the interest would usually come on Monday, Wednesday, or Friday because surgery is surgery. And I did see an interesting couple. I saw a man who came in. He has 7 children, all ages,
Wow.
right? He's only in his early 40s. And when he went to get his vasectomy, to which his wife drove him, when she picked him up, she said, "You know, dear, I think we made a mistake." So he came to see me for a reversal for baby number 8. Can you believe that?
Wow.
I know. That's a devoted husband. I would have been furious. Surgery, permanently sterilized, and your wife changed her mind.
Wow.
So we are going to reverse it.
Okay. Well, good for him. Good for his wife. Good for the babies.
And she homeschools the children.
Yeah. Whew.
Anyway, how about your week?
I had a great week. I saw a couple back who, he's 81, she's 77. I see both of them as patients. And Larry, they are having the best sex of their lives. In fact, every time I see them, I'm like, tell me more about what's going on. I feel like I'm living vicariously through them.
Right. So what's going on?
So I treat him for ED. I have him on Trimex injections. I also am managing his testosterone therapy. He's on oral testosterone, doing well. And she is super interesting because for 50 years, she was not able to have penetrative sex comfortably with her husband. So when she saw me, that was a concern of hers because he wanted to have sex. And I sent her to see a pelvic physical therapist because no woman should have to suffer through pain during sex, right? That is like very easily treatable. They just need to see the right people. So she saw a pelvic physical therapist. And you know what I also did is I taught her about some different sexual wellness products. So I have a whole room in my office of different toys. We went through the different ones.
Is it a dark room or is it like a regular?
You can make it dark or light. Depends on the mood, Larry. So she got a vibrator and she has a clitoral suction device. And she uses both kind of like during
and she travels
foreplay.
with a suitcase.
She travels with a suitcase. And he literally told me the other day, there are noises that come out of my wife's mouth that I've never heard before.
I got scared when you said came out of my wife's. I was waiting for something really kinky.
So I just love.
So what did they do for 50 years?
Well, they didn't have a lot of sex.
They stayed together.
Yeah, but a lot of these women that I'm seeing now, they tell me, hey, I'm not a sexual person. But then when you actually treat any of these underlying issues and you teach them, different ways to actually enjoy the experience, they come in and they say, Amy, I was wrong. I was telling myself this script that actually wasn't true. I had another woman literally this week say, Amy, I'm a very sexual person. So yeah, I mean, she wasn't enjoying it clearly for 50 years and now she's living her best life.
And he didn't cheat.
I mean, I don't know.
Well, I mean, that's important,
no,
right?
He didn't. No, he's a very loyal man.
Yeah.
Yeah.
Well, that's so nice. It's got like a happy ending.
It has multiple happy endings.
Well, I don't have anything. It has daily happy endings.
It has daily happy endings. So let's go into some breaking bedside news here.
Oh, yeah, sure.
All right. And I kind of want to get your opinion on this too, because you're a master, at research. And so I want to see what you think about this topic. In the field of urology, nearly half of all pregnancies in the US and worldwide are unintended. Okay. It's why a lot of us offer vasectomies in our clinics. And now, after 50 years of essentially no progress in this space when it comes to male contraception, we now have an option that might be a game changer to allow men to actually have a say in their, fertility or infertility. So hot off the press, just published in Communications Medicine in late July, the first in-human study for a brand new non-hormonal oral male contraceptive called, it's a big one, YCT529 was published. And it doesn't look at efficacy, so that's a big one, right? It's just looking at safety on this non-hormonal medication. So just off the bat, what do you think about this?
Well, I think your intro made it sound very exciting.
Yeah.
It's a non-hormonal contraceptive. But we have no data.
Yeah.
I read it expecting something.
Yeah.
Nothing.
Right.
So it's, I think, 16 men who they gave variable doses of this, and I call it YICT 529.
Okay.
And it's a retinoic acid receptor antagonist. So it blocks these receptors, which are the active components of vitamin A. And it would be great if these receptors were just in sperm-producing cells. They're everywhere. So these receptors are active in epithelial cell integrity, in white blood cell production. In animals, they've been shown to be tumorigenic. So I'm just a little concerned. How is this particular product affecting only the receptors on sperm?
Yeah.
And so these people have to show me a little bit more data of how they made it, what it's doing, and why is it not going to affect these other important cells that we don't want to be downregulated.
Yeah. Now, in the study, they did look at any impact on hormones that we typically check, like testosterone, for example. There was no impact on that, which I think we would expect, right? Because it's a non-hormonal medication.
Well, wait. So if they're stopping spermatogenesis, wouldn't you expect the pituitary hormones to go up? They're not getting feedback from the germinal epithelium, and FSH and LH should go up. Nothing happens.
Yeah.
Come on.
Okay, so we'll have to look at what they're currently doing their next phase of their study to look at efficacy.
Right,
So
but
we'll
I think the intro that it's going to be a non-hormonal male contraceptive is what gives it its excitement.
Yeah.
We don't have the data yet.
Yeah.
We just have the title.
All right.
So let's
trash or
wait.
treasure?
So I'm giving it a thumbs down trash.
I'm giving it, I guess I don't know yet. I'm somewhere in the middle. I'm hedging.
No. You only have trash or treasure. You can't hedge.
Okay, it's fine. So here's what I'm saying is based on this early work, it's safe. So I like the safety component because when it comes to something that I'm offering my patients, safety is number one. I don't want to hurt anyone or have a therapy hurt anyone in the process, right? And if it shows to be effective, then it's a treasure.
Okay. I'll accept that, but I don't agree. Next topic.
So our guest today is Lee Labrada. And you invited him on our podcast, and you know Lee personally.
I do. Lee and I have been friends for 15 years, 20 years.
Wow. So you met when you were 5?
Yes, I did. We were teenage friends. And that's not even nice. And so I think he is an extraordinary person. Lee was a professional bodybuilder, has won numerous accolades and awards for his bodybuilding days. But even more importantly, he has now developed a hugely successful supplement line called Labrada Nutrition, and has become really an authority on nutrition, men's health, and how people can achieve their goals of staying healthy and becoming kind of the man they want to be. And I think for that reason, I'm really anxious to hear Lee talk about his advice to up-and-coming athletes and just people who want to stay in shape.
Yeah, and you were actually on his podcast before.
I was. Lee and I did a podcast. He has a regular podcast, and he and I talked about a lot of things relative to, I think, steroids and health. And he just had a bodybuilding show that he does every year called the Labrada Classic, which I went to. It was hugely attended. Yeah. And he said it was the best year they've ever had. So he is an extraordinary entrepreneur. And you haven't met him yet. I'm sure you will get to like him as much as I do.
Yeah. And when you were describing his secret sauce back in his bodybuilding days, why was he so special and eloquent on stage?
Right. So I don't know whether everybody thought this, but to me, Lee's performance on stage was literally a ballet by an athlete. I mean, you have to see this to appreciate it. But he didn't just go out there and stand. I mean, he had a beautiful, beautiful athletic routine. And I think he has become known for that. And other people really do emulate him.
Yeah. So we're going to pick his brain today because he helps motivate people all over the world to live healthier lifestyles. And I think that's one of the challenges of you and I in our clinic is how do we get people of any age to make better lifestyle changes?
Yeah, I think that's really true
Yeah.
about Lee. He is kind of a role model for up-and-coming athletes and people who just want to stay healthy. So likewise, anxious to hear him answer some of our questions. Hello, Lee, and thank you so much for joining us today.
Thank you, Larry. It's a pleasure being here.
We really want to pick your brain, and I want to start with a real case.
Okay.
So this is a 35-year-old gentleman who comes to see me complaining of fatigue and inability to put on muscle. He's also trying to lose fat and increase his muscle mass. Most of his friends are taking testosterone, so he comes in thinking that he has low testosterone. I test him, and his testosterone is the mid-500s, certainly not low for a man of his age. He's working out 5 days a week, eating what he says is properly, and he cannot understand why he's not putting on muscle. So where would you go first with this gentleman?
Well, let me jump in here really quick.
Sure.
Sorry, I don't mean to cut you off, Lee.
Sure.
So why this case is so important is because Larry and I see this guy, we're going to call him Tom, okay? We'll call him Tom, all the time in our clinic, right? And if we tell him, Tom, just move more and eat less, what's Tom going to do? He's going to keep doing what he's doing, and he's probably never going to reach his goals, right? He's not going to reach like the peak of what he could accomplish.
Right.
So if we tell him that, we're telling him we can't help you as a doctor, right? We're telling him figure it out on your own because we didn't really learn the nuances of how to educate this guy, Tom, and despite, many, many years of training. And really, so Vonda Wright is a very well-known orthopedic surgeon, and she talks to people about this critical decade of being 35 to 45, where people need to get their shit together, right? Because it will never be as easy as it is today to get in better shape. And I worry that this guy is going to show up at 55 years old with a real problem. And I'm going to ask him, why didn't you see me sooner, Tom? And in his mind, he's going to say, because 20 years ago, you told me you couldn't help me. So we want to pick your brain. How do we help this guy actually reach his full potential?
That's there's many facets to that. From my background, my experience as a bodybuilder, the first thing that I would say is that you have to encourage him to train with weights. Resistance training is extremely important. So I would delve into, is this individual training with weights on a regular basis? And secondly, what I would do is I would do a deep dive on how he is structuring his nutrition. How is he eating? Is he getting enough protein, for instance, which is vital to muscle growth. A lot of people get enough calories. They get enough calories from fats, carbohydrates, things that they eat. But there's almost categorically people are low on consuming protein, and protein is critical to muscle tissue, and muscle tissue is the basis of the metabolism. So that's really, really important. So building the metabolism through a combination of exercise and nutrition. The third one, which is the area of your expertise, is the hormonal balance. The testosterone levels have to be there. It is up to you to determine whether 500 milligrams is too low or whether he needs to be on the higher end of normal. And
that's really a difficult question because
that's
what is normal? And I mean, we wrestle with that all the time.
Sure.
And also these people come in at various times of the day and we're taught that you have to get their testosterone done before 11 o'clock in the morning. Well, we can't see everybody before 11 o'clock in the morning. So again, this 55 level of 550 in a man who's 35 really depends on the time of day when we're getting it. So that does become critical.
Sure.
Yeah.
And so, that is something that has to be dialed in because as you said, the low end of normal, what is it? The 200?
Could be like high 200s.
High 200s, but people feel really bad, high 200s. But, most doctors would say, well, you're in the normal range. And then the high end is 1100.
Most uneducated doctors would say.
Most uneducated
Not the
doctors.
most educated hormone specialist.
Right. Not the specialist.
Right.
So the higher end of normal is what, 1100?
Yeah.
Something in that range. So this is just from observation. Most guys, when they're in the higher end of normal, have better results than when they're in the lower end of normal. And so, that's something that has to be balanced out. But coming back to your question specifically, what do you tell them? I think you have to encourage them to make some changes. And you have to encourage them to make small changes. You're not going to give them just one pep talk and then they're going to, just magically transform their lives. So I think it's a question of having them check back with with you periodically, monitoring their body fat level to determine whether they're putting on muscle or not, and working with them more closely. Because if you're measuring the results, then I think that you're going to give them the necessary feedback that they're going to use to keep motivating themselves. So motivation is hard to maintain without some kind of feedback, or without the observation of some kind of measurement of progress.
So Lee, let me go back to something you said, because you started talking about protein. And we all realize that protein is important.
It's like the one macronutrient we can't live without.
Right. But it's hard to get the amount of protein you're supposed to get, which I believe is 1 gram per pound.
1 gram per pound of body weight is typically what I recommend for males that are exercising.
Right.
And probably on the low end.
It can be higher.
Yeah.
And if I can speak to that for just a second, people think that when I tell them to consume more protein, I should just go out and eat more steaks. Well, I'm going to get fat. Well, no, not necessarily. There's protein in egg whites. There's protein in chicken breasts and fish and a number of things, protein powders, protein shakes. And the important thing is to consume enough of that to feed the muscle tissue, because that muscle tissue, really is the determinant of how high that metabolic rate is going to be. One of the major factors. And then the other one is I truly believe that it's one of the markers of aging. So the more muscle you have, the better off you are.
So let me ask you something. It's easy to buy protein off the shelf.
Sure.
And we all know you're a manufacturer of a great protein.
Right, lean body.
But what are the sources of protein when you buy them that are considered better than others? I mean, is plant protein, is whey protein? Do you have to go to, like you say, steaks? I mean, does it make any difference, or all proteins equal?
No, I don't think that all proteins are equal. I think what it comes down to is the digestibility and the bioavailability of those proteins. And what the current science is showing is that proteins such as the whey proteins and some of the higher quality milk-based proteins, sans lactose, without the lactose, okay, we're just talking about the protein strictly, are some of the higher quality proteins in terms of the amino acid makeup and the balance.
What's your source of proteins for your products?
We use milk protein isolate in the lean body shakes. Yeah. Yes, and that's essentially they take the milk and they just filter out all the lactose, all the sugar. We end up with a product that is 0 grams of sugar, and what remains is the milk protein isolate, which it has the casein and the whey components.
So your recommendation is keep your protein up. The target would be your weight in grams of protein.
That is correct. And space that out, space that protein intake out over the period of the day. So
how do you do that?
So about every 3 hours, Larry. And so if I'm going to consume 150 grams of protein, then I take 150 divided by 3, divided by 5, and I get 30 grams of protein that I eat five times per day.
I know it's interesting. When you say 30, it doesn't sound so bad.
Sure.
When you say 150 for the day, it
sounds like a lot, right?
Yeah. So do you watch that carefully?
Well, because my sister does medical weight management, her big thing is you have to eat protein and you have to be very intentional about it. So everything that you're eating, you have to ask yourself, is this going to contribute to my protein or fiber goals today?
Right. I'm going to change my whole lunch today.
Yeah. So one of my favorite snacks would be like a 2% Faye Greek yogurt, has no added sugar. That's 15 grams of protein right there.
Excellent.
If I add a little pack of almonds, that's about 6 grams of protein. That's 21, right? Or if I have a protein shake, that's 20 grams. Fairlife milk is a great, protein source. That's 13 grams of protein, plus a Greek yogurt, 15 extra grams. So I'm counting that now because I'm realizing I am very protein malnourished.
Right. And I think that most people are.
Yeah.
I think I am now.
Yeah, I think you are.
I'm going to leave right now.
You're going to go have a protein shake?
Protein.
Okay. So I think that the easiest way to do it is just to space it out over the course of the day. So every 3 hours. And so people look at me and go, how on earth do you eat every 3 hours? Well, just think of breakfast, lunch, and dinner, and then a mid-morning and a mid-afternoon snack. And just make sure that every time that you eat, you get a little bit of protein.
When do you stop eating during the day? Is that important that your last meal not be too late?
If you're trying to lose weight, which a lot of us are, then the metabolism does slow towards the tail end of the day a little bit. So I would say don't eat after dinner if that's the case. But for most other people, and especially those people that are weight trained, their metabolism is good, they're not experiencing a problem controlling their body fat, I would say that just every 3 hours. Every 3 hours is the way to go.
Yeah.
So let's go back to our guy, Tom. So he's like, okay, so Dr. Pearlman, you're telling me I need to eat more protein. Give me an example of what I should put in my lunchbox.
Okay, that's a good question. So that's assuming that you have breakfast, right?
And a lunchbox.
Yes. Yeah, and a lunchbox.
So what she's alluding to is the idea that you prepare your foods in advance, put them in your lunchbox, and take them with you, which I think is excellent. Because if you fail to plan, then you're planning to fail, as they say. So you have breakfast at home. And that can consist of egg whites, oatmeal, a piece of fruit, or, as you said, like a high-protein yogurt, piece of fruit, that kind of thing. Mid-morning, I would have a protein shake, like one of our lean body protein shakes. That's 40 grams of protein. For lunch, I would have a chicken breast or a piece of fish, whole grain rice, and I personally liked black beans. So, a lot of times I have beans and rice and a chicken breast or fish for lunch. Now, these are packed into my lunchbox, and so they're in individual Tupperware containers, and at work what I do is I just put them onto a plate, put them in the microwave, I heat them up, and I'm ready to go. That way I don't have to go out and waste a lot of time in traffic and lines and end up getting a lot of fat and things that I don't want in my restaurant food.
And no control over what you're actually eating.
And no control over what
because you
you're
have no
actually
idea what
eating.
they're adding.
That's a big one.
Yeah.
So how about if Tom says, hey, listen, I'm really thinking of going all vegetarian. Is that feasible?
Is it feasible? Yes, especially nowadays, it's feasible. It's a lot easier to achieve than in years past. Do I recommend it? That's not what I would recommend. Because I think that there are some limitations in terms of the amino acid profiles of plant-based foods.
That's interesting.
Okay, and I know that vegetarians combine those foods. But I think that it's not just what you consume; it's what you assimilate. And I do think that there are higher quality sources of protein.
Well, and leucine is a really important amino acid that we need. And you have to eat a lot of like certain, plant-based foods to get that, like a ton of it.
Where do you get it if you're not plant-based? The main source of leucine, just what?
There's high leucine content in whey proteins, for instance.
Are there?
Yes, so that would be a good source.
Your
and
products
leucine is a rate limiting. And interestingly enough, leucine is a rate limiting amino acid in muscle growth. So if you're interested in packing on muscle tissue, putting on muscle tissue, you need to check your leucine intake.
You want it high.
You want it higher.
So in your drinks, do you have a focus on adding the leucine?
It's already in there, naturally occurring in the milk protein isolate.
So that's really important. I would never think to look for that when I buy a product of the leucine content.
No, it won't be on the ingredient panel. It'll just be a constituent of the amino acid profile of the protein that's in the drink.
Right.
And in this case, milk protein isolate is high in leucine.
What is not high in leucine? So you know what to avoid.
Larry, you stumped me on that one. You stumped me on that. What is not high in leucine probably are carbohydrates.
No, I know that, but I mean when you buy drinks or bars,
yes,
and it has protein,
right.
Not all protein is equal.
Right. So I stay away from the drinks and the bars that are like, say, soy-based or plant-based, and I opt for those that are high in whey proteins or milk protein isolates.
That's interesting.
I drink a protein shake that has pea protein, which I like.
Pea
protein.
I mean, from little peas. We are urologists, you know. You have to be careful.
Yeah. But the other thing, Larry, I don't know if you've ever gotten this question, is guys that are nervous to consume soy products because they're worried it's going to lower their testosterone and raise their estrogen. But edamame is an incredible source of protein. In a little snack pack, it has like 11 grams of protein in it.
But it is high in estrogen.
Well, but it doesn't impact someone's estrogen levels.
Yeah.
So, and there's like Cochrane reviews that look at, testosterone and estrogen. So I tell my patients, like, as long as you don't have a soy allergy and you like it and you don't add all these extra ingredients to like your tofu, those are perfectly fine products and ways to get, plant-based protein.
Sure.
Right.
And I'm not a crusader against plant-based proteins. I want you to understand that. I've consumed them myself. I just don't think they should be the sole source of your protein intake. I think that there's a lot to be said for animal source protein.
Yeah. Variety is the spice of life.
You mentioned estrogen. And I think there's a mindset out there among athletes that no estrogen, we don't want any estrogen. And in reality, you need some estrogen or you develop all types of symptoms, especially sexual symptoms.
Yeah. So what do you see? I mean, when guys come in, I've certainly seen it. When we bottom out their estrogen levels, sometimes if we're using too much anastrozole, like they just kind of feel crummy.
And they also lose their sex drive. So, when people come in complaining about sexual dysfunction, I am going to check their testosterone and their estrogen, not just their testosterone.
So Lee, you have a company that sells protein drinks,
We
right?
do.
So, but yet most of what you consume in a day are not supplements.
So see, the key word is the one that you just said, supplements. You know, they are supplements to a whole food diet. They're not substitutes for a whole food diet. So our lean body protein shakes make it convenient to get 40 grams of protein, but that doesn't mean I'm going to be taking one of those 5 times a day. You know, I'll be having, you know, solid whole food meals at breakfast, lunch, and dinner, and then I will take a shake at mid-morning and mid-afternoon.
That is so key.
So it is a good snack. It's a good between meal.
Absolutely. And the reason that lean body is so popular, besides just tasting great, is that it allows you to get 40 grams of high quality protein with 0 grams of sugar. It's convenient, Larry, because a lot of people don't have time to go to a restaurant or to prepare the food at home.
Yeah.
One thing I wanted, you mentioned, we were talking about Tom. He's working out 5 days a week. So then we get into the whole area of how much working out is too much working out. And when you work out, how long should you work out? And these are things that I know you touch on, but I think it's important to share with our viewers because it's poorly understood.
Sure.
Yeah. And him just checking the box that he does exercise is not going to be enough for you and I helping Tom in our clinic.
Right. So if you are consistently sore and run down, not recovering from the workouts, or getting weaker instead of getting stronger, then you're overtraining. You're doing too much. And that's like the equivalent of going out and trying to get a tan but getting sunburned instead.
Oh, that's a good analogy.
You peel, you lose your skin, and you got to start all over again.
Yeah.
Same thing. So you have to push the muscle to the limit, you know, where you induce a response, you know, and that response being an adaptation, you know, meaning muscle growth. Okay, but you can't do so much that you end up tearing down muscle tissue and not recovering. So it's a fine line. So what does that typically work out to in real world terms is probably about 45 minutes of intense weightlifting. You know, 4 or 5 times a week is enough for most individuals.
So when it comes to working out, you recommend maybe a minute between sets, a minute and a half. So you can't stand around and talk.
Yeah.
The best rule of thumb that I've ever come across on rest periods, because I get asked that a lot, is simply this: long enough to catch your breath. Once you've caught your breath, it's time to start the next set. Yeah. So if you've just finished a set of squats or leg presses, you know, a heavy exercise, you might be breathing hard for 2 minutes. Yeah. But if you've just done a set of abs or you've done a set of bicep curls, you may only be breathing hard for a minute. You know, so long enough for your training partner to go and do his set, or to catch your breath.
So should Tom be working out with a buddy? Should he try to get himself a trainer? What is the best way for someone to get effective exercise in without hurting yourself?
The way that you've described, Tom, I would say that individual needs a trainer, you know, to help keep him motivated and or just to teach him the basic things, the basic tools that he needs in order to change his body. You know, short of that, I would say training partner, because a training partner, you know, will ensure compliance because, you know, your partner's going to show up, you're going to show up too. You know, so there's some accountability there. You know, so I think that accountability is really important. And whether that accountability is to another person, which is what I recommend, or whether it's to yourself, you got to be accountable.
Right.
Let's touch on this recovery thing. Sorry, I didn't mean to interrupt you, but I'm going to interrupt you anyway.
What were you going to say?
So Tom, let's say he's like sore after some of his workouts. I mean, I see this all the time where my guys come in and they say, hey man, I'm working out, I have a trainer. I feel sore after I'm working out. I don't really like it. What do you recommend? Like, do you recommend a peptide? Do you recommend testosterone?
You're asking me?
Yeah, I'm asking you. Yeah.
First of all, I don't think being sore is bad.
I don't think it is either.
Because you are injuring muscle fibers when you work out. That's why they grow.
And there's some inflammation.
Yeah, and I think if you're not getting sore or you're not getting out of breath, you're doing something wrong, right? So, you know, that to me is not a red flag to institute some type of therapy. I will say, and this is getting into a very shady area, which is good for another day.
Like shady.
But it's peptides. And, you know, because what I'm using now are some anti-inflammatory peptides. But I really don't want to get into it now because it's a whole can of worms.
Yeah. Well, I literally had a preventative cardiologist call me the other day. He refers a good number of his patients to me, but he was calling on behalf of himself. And he's 49 years old and works out all the time. And he's like, my shoulder is bothering me. You know, it's not just like a soreness. It's like, it's bothering me. I can still work out, but it's annoying. What do you recommend?
Orthopedic surgeon.
Well, he saw an orthopedic surgeon and they said, we could inject this one, but it's not just one joint. Yeah. It's this joint, it's this joint. This is a systemic inflammation problem.
Yeah. Well, I've been using an anti-inflammatory peptide.
On the next episode.
Yeah, and we will discuss that. We will discuss that at another time when we talk about things that people can do to enhance their workout or change their body, whatever.
Yeah.
But I think the subject of trainers is kind of a slippery slope.
Sure.
Because there's trainers and there's trainers, and how do we as non-trainers pick trainers.
So you have to do your homework because it's too easy for somebody to take a course and then hang a shingle out and say that they're a trainer.
And they can do it online.
And they can do it online. I would ask to see some results from other clients that they've had, before and afters and whatnot.
The one thing I use is kind of like very superficial, but if my trainer does not look like he's in good shape, I'm not going to use that trainer. Because if he can't take care of himself, how's he going to take care of me? And yet, a lot of these trainers don't look very good.
Right.
That's interesting.
Well, and we can understand in the healthcare, industry, right? I mean, a lot of us as doctors don't take care of ourselves, and we wonder why aren't our patients listening to us? When it comes to the advice, I think it makes total sense. When I hired a trainer a couple months ago, I hired the biggest, buffest dude at the gym.
Well, I hope he put together a good program for you.
Yes. No, I mean, I think that's a very, superficial way of judging, but it's a good first step.
Yeah.
And then they have to be able to, communicate. I mean, I don't want them not being able to describe to me what I'm supposed to do.
Sure. Yeah.
And sometimes they can't, you know?
Yeah, that's important that they be able to show you, right?
Yeah. Or else they can show me.
Yeah.
But I mean, I think trainers, I've always used a trainer.
Yeah.
Because it forces me to be there, like you say. I know I have to be there. I have to, I'm committed to meet him. So, I mean, I like that idea, but not everybody can afford a trainer. So I think buddies are good. If the buddy is somebody who, again, knows how to work out and is not going to hurt you.
I think it's good to hire a trainer, even if it's just for a few sessions. You can learn, you can take notes, and then you can do it yourself or you can do it with a buddy.
So when you go, let's say this Tom is going, we're going to cut him down to 4 days a week. Or are we going to keep him at 5?
It depends on the schedule and the needs of his program.
Yeah, well, he's trying to put on muscle. He is 35.
He wants to get ripped like Larry.
Yeah.
What?
He wants to get ripped like Larry.
Yeah, it's like me.
4 to 5.
But how are you going to advise him on body part training? Do you like doing total bodies, or you like push pulls?
I like push pull.
Can you explain what that is?
Sure, absolutely. So let's start with total body, which you brought up, which is basically to do an exercise for each body part in one exercise session. Right. So you might start with the legs, and then you do the back, and then the chest, and the shoulders, and so forth. And you do a circuit, or you break it up differently, but you get the entire body exercised in one session. That's total body, as you call it. What I like instead is
Do you not like that?
No, not for an advanced athlete. For a beginning athlete, absolutely. Somebody that is just getting started out, for sure. That's the way to go. And then I would just do that 3 times a week: Monday, Wednesday, Friday. Take the weekend off.
That's what I do.
Yeah,
and it's good. Anybody cares?
And it's good. Yeah,
I don't know if anybody cares.
We're going to have you do a double bicep when we're done.
No, but that's what I do. But anyway, go ahead. Yes,
Larry, the other system, which is the one that I prefer, is the split system. And so what you do, as the name implies, you split the body up into different body groups. So one way of doing that is what we call push-pull. The pushing muscles, which we say are the chest, the shoulders, and the triceps. They're all involved. They're correlated. Those are the push muscles. The pull muscles would be the back and the biceps. They're involved in pulling. And then a third day for leg training. So I would say that split system there. And then that can be done on a 3-on, 1-off basis. 3 days on, 1 day off, or it can be broken up over several days.
What do you do?
I've really cut out cardio because my sister said, Amy, why are you on the Stairmaster? You need to lift heavy shit.
Yeah.
And
what do you think?
I think that lifting heavy enough to where you're performing 8 or 10 repetitions and you're tired at the end of the 8 or 10 repetitions, you hit what we call failure, where you can't do another rep. That's probably the proper rep range. Although you could go higher, you could go as high as 15 or even 20. But I think the important thing is to tax the muscle and to go to the point of failure.
Yeah, because I'm kind of like Tom. Like, I'm trying to build muscle. I'm 38 years old.
I don't like that look.
What, you don't like that? Well, here's the thing.
Personally.
Yeah. Oh, let's get
I don't
personal.
know about you guys, but personally, I don't like the look of women who are overly muscular.
Yeah.
I mean, toned is one thing.
Right.
But rippling muscles in a woman is just not my thing.
Oh, yeah. Here's the thing, Larry. I'm 38 years old. In the next few years, I'm going through perimenopause and then menopause. And as you've mentioned in some of your content, muscle is a metabolic organ. And I don't want to be like so many women who start developing prediabetes and high cholesterol as they go through these hormonal changes because of a metabolic issue.
But are these women suffering from decreased muscle mass? Has that been demonstrated?
Oh, yeah. Because my sister checks it every month. So we have a bioimpedance scale. And like a lot of people, men and women, are sarcopenic and they had no idea. And they have osteopenia and osteoporosis. And the reality is I have to prepare decades in advance of what I know, because 100% of women, if we live long enough, are going to go through menopause. So I know that, which means I need muscle in the bank before those changes ever happen.
Right.
So I'm like super focused now on building muscle. And because we have a bioimpedance scale in our office, I know exactly how much muscle I have. Larry, I'm in the yellow. I'm not in the green. And I work out every day of the week.
You might be doing a little too much, and you might need to increase your caloric content a little bit.
I want to get into steroids a little bit here. Is that okay?
Yeah.
Because Tom, we're not going to put him on testosterone, but what I tell my patients in my clinic, because a lot of them will say, I don't want to hurt myself. I don't want to become a bodybuilder. And I kind of like laugh and I'm like, if only if it were that easy just to be on testosterone and become a bodybuilder, right?
And
like there's a lot more
and that's a misconception. I think that some in the American public look at bodybuilders and they go, oh, well, that's just a bunch of injections.
Yeah.
And I would challenge those individuals to try to achieve that by just taking a bunch of injections.
Yeah.
It can't be done.
But see, that's really an important point.
Yeah.
The misconception about testosterone. I mean, a lot of people think that they can take testosterone and sit and watch TV and eat, potato chips,
anything they want,
and they're going to change.
Oh, the life, Larry.
That's not
Right?
That's
I
not
said
true.
the life, if only.
Yeah.
And they don't realize that testosterone is not magic. Testosterone is
It's a catalyst.
Tool. It's a tool
Yeah.
to help you accomplish something, but in and by itself,
Sure,
it's not the magic answer.
Sure.
So anyway, I'm sorry.
And you're speaking to it just from the standpoint of muscular development and body composition. How much
I'm
body
not
fat, how
talking
much
about-
muscle. Because there's other things involved, as you already know. Mental well-being, libido. Even some cardioprotective factors, which you're way more familiar with than I am.
Yeah.
Yeah.
But
I have
anyway,
a lot of patients.
let's go where you were going to steroids, and I'm sorry I interrupted you.
No, it's okay, Larry.
So what's the question?
So when I tell patients, like the doses that I use in clinical practice are like 1/10 the dose that some people will use who are overusing these products. So is that true? Like how much are people using?
The anecdotal evidence shows that yes, there's abuse of that. Because people think that if I take one, it's great, but if I take two, it's better, and if I take five, it's even better. And really nothing could be farther from the truth because there's a law of diminishing returns, and you start getting all sorts of side effects and things.
But the other thing is, there are androgen receptors, and they only can function up to a point they become saturated.
That's right.
And all the excess testosterone is going to just give you its adverse effects and not its beneficial effects because you've exhausted its beneficial effects. So you really have to understand your body and what it takes for you to get from A to B, and it's not the same as the guy working next to you. Everybody's different.
Yeah.
So, I think the doses of testosterone are very individualized. There's no one size fits all.
Yeah. Like the maximum dose that I would use for, let's say, testosterone cypionate is 200 milligrams once a week. And I found over the years that a lot of my patients don't even require that much.
Right.
And they feel just as well on a lower dose. I've actually gone down on my dosing over the years.
Well, and this is where you and I are coming at this differently, because a lot of my patients are people who are trying to get, competitive. And for that purpose, I will go higher. But I'm watching them very closely. I mean, I see my patients every 3 or 4 months, and we check everything.
Like, what are you
each time.
checking?
We're checking hematocrit, of course. We're checking estrogen. We're checking lipids. We do a CMP. And one of the problems that I see with muscular guys is that they tend to run high creatinines because they're breaking down muscle products. And what happens is that that's used to calculate their kidney function. And it's wrong. You can't do that. You have to do a cystatin C. But these people end up going to other doctors who get all concerned, send them to nephrologists.
They don't have context.
All they need is a cystatin C and they're fine. So that's, I do follow these people very carefully. If people don't come back, I'm not going to take care of them because I'm accepting responsibility for these people's health, and I'm writing prescriptions.
Yeah.
And, so I'm really careful.
What about heart health? Like, are you getting echoes on patients?
I am, for most of my big guys, I am sending them to the cardiologist for a cardiology clearance at a young age. Then we get a baseline. In their 30s, I'm sending them. And I have a cardiologist who really understands and is not going to look at their chart and say, you're taking testosterone, you should not be. I don't want that. That's not going to help me.
Yeah.
I want somebody who understands what they're doing, why they're doing it, and just making sure their cardiovascular system is fine. And it's amazing. But the people who are taking all these testosterone steroid supplements, I have not had one have a bad report from the cardiologist. And I think it's because they're doing so much cardio and they're also eating so clean. They just they're not entering into the normal things that can cause cardiovascular disease at a young age. They're avoiding it. But I get 90% of my people cleared.
Yeah. How many other urology colleagues, like, do you know that you feel like have a similar approach to you in terms of welcoming people into our clinics and saying, like, I understand what your goals are. Let's see how we can work together to do this as safe as possible. Like, I just hear this sentiment from a lot of people. Like, if they know that like patients are using steroids and they're not prescribed, they won't even see them as a patient. Right. I find that problematic because we can help that person.
I do too, because if I don't help them, they're going to go to somebody who doesn't know what they're doing, or they're going to get medication from their friends, and they're going to get sick. And I feel like I'm a doctor. That's what I'm supposed to keep these people from getting sick. And so, as long as they, do what I tell them to do in terms of coming back and getting clearance and getting their labs, I'm okay.
Yeah.
I'm okay with seeing them. In terms of how many people, very few people do this. So.
So there's one more topic that I want to hit on here. So you have 3 boys.
Yes, we do. We have 3 boys.
And your wife's name is Robin?
Yes, that's correct.
And you had your children when you were training for competitions as a bodybuilder.
The first one was born when I was still competing at the age of 32. That would be my oldest hunter.
Yeah. So can you walk us through a little bit? Because sometimes testosterone can make someone infertile, but people can also have children on testosterone.
I think you have to look at the individual, because the individual is going to have certain characteristics, everything from genetics but assuming just a baseline, if an individual is taking too much testosterone, right, then what we're talking about is suppression of the system. We're also talking about the suppression of sperm production. So in my own case, when I first went to the urologist at the age of 30, and I had the sperm count done and such, it was on the lower end, okay? And he looked at me and he said that, you're not going to be able to have kids. And I said, do I have any sperm? He goes, yes, you do. And I go, watch me. I only need 1. And so lo and behold, Hunter was born 2 years later, and then 2 years after that, Blade, and 2 years after that, Pierce.
So we're on a schedule here.
Yeah, on a schedule. We didn't have any problem. We didn't have any problem whatsoever. But again, I think it comes down to, being moderate on the intake of the testosterone and not getting into a chronic suppression stage the way that some bodybuilders do, because they take the product year round.
And when they're cycling, they're not actually cycling like completely off of it and taking other medications.
So you'll see some of the you'll see some people that will take testosterone year round and they just reduce the amount that they're taking instead of coming off completely, and using HCG, and other things to bring their system back up to a normal level. So I think it's really important to approach it from a health standpoint.
I think one thing that needs to be appreciated is that, for the most part, the people who are going to be in this situation start out as being very healthy guys, right? And we know that if you take somebody who's very healthy, suppress their sperm production, and then let it come back, they're going to get pregnant at a much lower number than the man who shows up in our office coming in the door with unexplained low sperm numbers.
Well, he'll achieve a pregnancy much more easily.
Who?
That guy that you're talking about, who's coming in healthy.
No, but what I'm saying, the people who we see for infertility in general, not bodybuilders, who come in, or athletes, who come in with low numbers of sperm, have a reason for that often we can't even identify. These people are suppressed. They're taking good numbers and suppressing them. So when they start coming back, they're healthy sperm. And I think that's where the confusion comes in, as like, why did Lee get established pregnancies when he was told he couldn't? It was because whatever he had was healthy. It wasn't from the get-go abnormal production. I think that's a big difference.
Yeah, it's a big difference.
Amy, can I ask you a question?
Yes,
so I want to ask you, at what age do you recommend for men to come in and get their testosterone levels, their base levels measured?
I offer every single person who sees me a testosterone level. I love data. We can't track what we don't measure. And I ultimately, a lot of people are talking about now, and Larry, you may or may not agree with me, but it's the delta, right? It's the change in testosterone that people feel and not necessarily the absolute values. So, it is way easier for me to treat an 81-year-old guy than a 20-year-old guy.
Sure.
But I love when the 20-year-old guy comes in to see me. Because again, just like with Tom, that's an opportunity.
Right.
He's coming in, and sometimes they come in for like a well man's visit. And that's like not a thing, right? There's like a well woman's visit. I could call a gynecologist and say, I want my well woman's visit. Like, when does a man call in and say, I want a well man's visit? But they should be able to do that.
I agree.
I've sat down with a guy who was like in his early 30s, and I'm like, what do you want to talk about today? And he's like, just tell me what you think I need to know at the age that I'm at. And I'm like, all right, amazing. let's start with hormones. And then we'll talk about vitamins and supplements, and we'll talk about exercise, and we'll talk about prostate and urinary stuff. And so anyone I will offer. And some guys are like, no, I'm good. And others are like, yeah, that sounds amazing. I'm like, here's the script, and I love it. And then even if we're not going to do anything about it, hey, that's one data point. Who cares?
Yeah, I'm seeing more men coming in with testosterone levels from their primary care as part of their screening.
That's good.
No, it is very good. It is very good. The problem is understanding what it means and does it need to be treated. So, I don't treat a number. When my patients come in, if their testosterone's on the low side and they feel great, I'm not going to treat them. So, I think if you're going to give somebody therapy for low testosterone, it should be associated with symptoms that go along with low testosterone. Or else you're going down a rabbit hole. When are you going to stop?
Yeah.
What's your end point?
Yeah. I think the question too is like, how often should you repeat it? And my response is however often my patient wants to repeat it. But I think if we just check a level at, 35 years old for Tom and it's 550, that doesn't mean we stop there. It doesn't mean he has a normal testosterone for the rest of his life. It means if Tom feels different in any way, like he's not like himself a year later, we repeat it as well as other labs.
Yeah, and there's also, general illnesses that can affect your testosterone. So it's always not a primary testosterone issue as much as the testosterone reflecting what's going on in your general health. So it's a good metric of overall health.
Yeah. One more question for you, Lee. So we're talking about Tom, and he's a young guy, but is it ever too late for someone to change their body composition?
No, absolutely not. In fact, I get asked this question a lot. I'm 65 years old and I'm in great shape, and I get asked by a lot of people, it's like, should I go get my testosterone level measured? A lot of them tend to be over 40, and I tell them absolutely. Go get a base level, measured, and if you're low, they will put you on the appropriate treatment. But I think that I think that it's never too late to check your hormone levels, to start training, to start exercising, start eating better, and looking towards your health. A wellness thing is regimen, as you call it.
I don't think enough older people work out.
I think you're right. And it is muscle tissue and strength are definitely biological markers of aging. Yeah. So I think that you can not only improve the quality of your life, but your longevity by using weight training and by increasing the protein in your diet and making sure that you're eating healthy.
Even just osteoporosis. Get some weight bearing.
That's right. That's exactly right. Yeah, and in fact, they've done studies where they've shown octogenarians that start weight training and they have an improvement in osteoporosis. And when I mean weight training, weight training for a guy in his prime is different than weight training for somebody in their 80s.
Right.
But just resistance training in general is a good thing. You want to be able to maintain function, especially as you get older. You want to be able to just basically get up off a couch. You want to be able to climb stairs.
Yes.
You want to be able to reach in the overhead compartment of the airline and put your bag up there.
Tell me about that.
Just basic things. Yeah.
That's some really great points.
Yeah.
I've learned so much today that I'm going out and having some protein.
Yeah.
Larry, I got one for you.
Oh, thank you so much.
Here's a protein.
Is it my favorite flavor? It's one of them. This is, I really,
it's one of your favorite flavors.
I'm not saying this. I'm not saying this just because you're here, but this is really a good product. Yeah. I do use it.
Thank you. I appreciate that.
So I think we learned a lot today on how we can better counsel our patients. That this guy, Tom, we can actually help him, but we have to get into the weeds. And, we have to ask him, walk me through a day of like what you're eating and counsel him on healthy protein options. So.
I would agree. Yeah. And taking measurements and then ask him to come back in 2 months or 3 months for additional measurements after having prescribed some exercise regimen to him, and taking a look at his hormone profile and putting him on a good diet. I think that, again, just being able to measure and show progress is what will keep that person motivated.
Okay, I have one more question for you.
Sure. I have one more question.
Okay, 2 more questions.
If you get one more question, I get one more.
Okay, fine.
Okay.
Ladies first.
So we have a bioimpedance scale.
That's what I was going to ask.
Yeah,
yes.
So we can measure visceral adiposity, skeletal muscle mass.
Right.
But let's say someone doesn't have access to something like that. When you say take measurements to measure progress.
So I think that there are good nutritionists, dietitians, and even some personal trainers that can use skin fold calipers to take measurements. Now, that is not the gold standard, but it will give you the relative change between one measurement and the other. That will be accurate. And then you can tell whether the body fat is coming down that way. Yeah, so I would recommend that you do measure your lean muscle mass, your body fat, to get a benchmark, and then measure it periodically thereafter.
Yeah,
okay,
and then just how our clothes fit, right?
So, yes, and that's another good point. Waist, your belt. The other thing is, do you think that these impedance scales are worthwhile?
Larry, I'm not an expert on the impedance methodology. I know that the gold standard is it still DEXA?
Gold
I
standard.
don't know. Some people don't like DEXA scans as much as I think these impedance scales are kind of taking over because they're affordable.
They're affordable and they're quick, right?
And they're no radiation.
Right.
So we can actually get data every single month and not radiate our patients.
So do you
every month.
look mainly at changes?
Yes.
Or that's what
called
I think.
relative change, not the absolute number measurement from one measurement.
Yeah, that's what I like.
Yeah. So you got to track it to hack it.
Yeah.
There you go. I love that.
I didn't come up with that. I didn't come up with that. Lee, it was so good chatting with you today.
We
are
Thank you
so
so
thankful
much.
that you joined us today on our podcast.
Thank you, Amy.
Yeah, so you certainly did not disappoint. You were great. Thank you so much.
Thank you, guys.
Okay, so Larry, why don't you give us some foreplay for our next episode?
Okay, foreplay.
Yeah.
So our next episode is going to feature Sean Nurian. Sean is the powerhouse CEO of Empower Pharmacy, the largest compounding pharmacy in the United States. And this is an episode you won't want to miss. So I guess fit is the final F word, because true fitness evolved. It's not just about how you live today, but more importantly, how you function tomorrow.
Folks, thank you for tuning in to Fertility and Other F Words. Don't forget to like, subscribe, and share this episode with your friends, and we can't wait to read your comments. Until next time.